The first two patients to undergo a groundbreaking aortic valve replacement procedure in Montana are doing great, according to their doctors. A specialized team at Missoula's International Heart Institute at Providence St. Patrick Hospital Monday performed what's called a transcatheter aortic valve replacement. Heart Institute interventional cardiologist Dr. Tod Maddux says they essentially replaced one of the heart valves, specifically the aortic valve, from the femoral artery in the leg instead of open heart surgery. Maddux calls it groundbreaking technology.
We essentially take a valve and fit it onto a balloon and take it up through catheters through the leg artery to the heart valve and replace the valve that is there that is diseased. You know, these patients are very sick from this disorder that they have, what we call aortic stenosis, or a tightening of the aortic valve. And there is no medical therapy for this. The valve is either replaced or the patients continue to do very poorly and can die from this.
Maddux says a transcatheter aortic valve replacement uses a valve made from cow tissue.
And it's similar in a lot of ways to a surgical valve in that it's a tissue valve. What is not similar is that it's mounted on a stent. This stent is much bigger than the stents that we are all familiar with that go in the coronary arteries to fix cholesterol blockages. Those are tiny compared to what we are talking about. You know, these aortic valves that we are replacing are roughly the diameter of a quarter or a little bit bigger, whereas coronary stents are the diameter of a pencil or less.
He says it took a specially trained team to make this complicated procedure a success.
And it's done under general anesthesia. We need multiple different imaging modalities. That is to say, we use both X-ray and ultrasound to sort of guide and place this valve. It requires, and this is one of the very important things to mention, a multidisciplinary team to do this. Cardiovascular surgeons and interventional cardiologists and cardiologists that are specialized in imaging, anesthesia, all working together to get this valve delivered for our patients. And it's been a tremendous undertaking for us. It's been 2 years. We've had to build a special room to even do this procedure. We call it a hybrid lab, but it's a full capacity operating room with all of the imaging equipment that we require to get this procedure done.
Maddux says both patients are doing wonderfully. The procedure was performed on Monday, and both were up walking around in the hospital without any assistance 1 day later.